Well, good afternoon. Throughout this outbreak, COVID-19 has presented an extremely serious threat to our healthcare system. If, God forbid, our hospitals had not been overrun by a sudden surge of COVID-19 patients, this pandemic could have very quickly turned into an absolute disaster in our hospitals. And we saw it across the world. We saw healthcare systems crumble in the face of this virus. And we saw the countless lives lost when this happened. Thankfully, thanks to our best efforts and everyone chipping in, this has not happened here in Ontario. But we always knew that the potential for our hospitals to be overwhelmed was very real. So from day one, it was all hands on deck. Our frontline heroes, our hospital and healthcare providers, worked day and night to make sure we had the capacity we needed. And part of that work included the difficult but necessary decision to stop many surgeries and procedures. By pausing these procedures, our healthcare system added over 5,000 acute care beds in an extremely short period of time. This critical capacity has meant we've been prepared for any potential surge in COVID-19 cases. We had to be ready for absolutely anything, and we have been. And our planning has paid off as we work to flatten the curve. As we see the trends improving, we're now looking at starting non-COVID related care again. We've been working with the Chief Medical Officer of Health and our healthcare partners to chart a clear path forward for our hospitals to fully reopen once again. We have developed a framework to restart scheduled surgeries and procedures safely, starting with the most urgent surgeries like cancer and cardiac procedures. And we are giving every hospital the ability to plan around their own unique situation. But I also know that many people are counting on these procedures to resume. Because to someone waiting for a surgery, nothing is more important. This has weighed heavily on all of us. And I want more than anything to get these surgeries and procedures back on track as soon as possible. And today's news is an important step forward. We're telling the hospitals to get ready. We're telling patients to get ready. And we're hopeful many of these scheduled surgeries can start soon. I know the delays have led to anxiety and stress, but I hope today can help ease some concerns. To those waiting, we're here for you. Help is on the way. Thank you, and God bless the people of Ontario. Now I'll turn it over to Minister Elliott.
Thank you, Premier, and good afternoon. Since the beginning of the COVID-19 outbreak, we have at all times prepared for the worst-case scenario. We looked abroad to Italy, Spain, and New York, and knew that if we didn't act decisively, our hospitals could have been quickly overwhelmed. Ensuring our readiness to respond to all scenarios, even the worst, has required tough decisions. No decision was tougher than delaying surgeries, especially cardiac and cancer surgeries. I know this has been very concerning to many people. Doing so, however, ensured our readiness to protect the health and well-being of Ontarians as we planned for a worst-case scenario. Because of the collective efforts of every Ontarian to stop the spread of COVID-19, we are now in a position where we can begin to plan for the gradual resumption of scheduled and elective surgeries and procedures. To do so, Ontario has developed a framework based on the advice and leadership of experts and leading clinicians from across the province in collaboration with Ontario Health. It's designed to help hospitals take an equitable, measured, and responsible approach that prioritizes the health, well-being, and safety of patients and healthcare workers. The timelines for when hospitals will resume surgeries and other procedures will vary as each hospital meets the criteria set out by Ontario Health. This includes the stability of COVID-19 cases, personal protective equipment and supply of medications, and adequate capacity of inpatient and intensive care beds, as well as doctors, nurses, and other personnel needed to perform the surgeries and procedures. These criteria will ensure that hospitals take a measured and responsible approach that allows for more life-saving surgeries while also preserving our continued ability to respond to COVID-19 outbreaks or surges. Because nothing is more important than protecting the health and safety of all Ontarians. Thank you.
We'll go to the phone line for questions. Just a reminder, one question, one follow-up, please. First question.
Your first question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Mike.
Hi, Premier. CBC is reporting today about how the inspections of a long-term care facility last month were done by phone instead of the provincial government inspectors actually physically going in to the building. And this was after there were a lot of complaints about a lack of infection control. I'm sure you wouldn't want, a plumber doing an inspection over the phone. Can you explain why that in the middle of a pandemic, an inspection of a long-term care facility would have been done over the phone? What's the justification for that? And what do you say to the people, whose family members are in that place where 21 people have died?
Mike, I'll pass this over to the minister.
Well, this was done because of the significant concern about anyone coming in from the outside in order to minimize the possibility of transmission of the COVID-19 virus. So it applied to everyone, it applied to family, it applied to visitors, it applied to staff, it applied to everyone. So this is something that we had to do in order to protect the very vulnerable population living in these homes. Not something that we wanted to do, but we had to do it for the protection of those people there.
Follow up?
Well, if I could follow up, could you explain then why that you would be doing, the labor inspectors, Ministry of Labor inspectors would do workplace inspections by physically entering places, and how you can actually make such an inspection actually thorough. I just don't understand how an inspection could possibly be thorough if it's done over the phone.
Well, it's not the, it wasn't done in the most ideal of circumstances, but again, just because of the transmission of COVID-19 in asymptomatic people as well, it was something that we had to do. But we have, we're working now with hospitals that are coming in, with the armed forces that are coming in, that are working to, first of all, stabilize the workforce to make sure that people are going to be able to come in there, that it is going to be a safe workplace, that the cleaning procedures are being done that needed to be done in order to make it a safe workplace for hospital staff as well as for the existing staff. So we've taken a number of steps, and we have people in there that are doing that work that needs to be done, and making sure that the very vulnerable residents are protected, and if they need to be taken to hospital, of course they will be taken to hospital. If they need to be isolated, they will be isolated. So we are taking every step possible to protect this very vulnerable group of people.
Next question.
Your next question comes from Douglas Boyd with Rogers TV. Please go ahead.
Good afternoon, Premier.
Hi, Douglas.
Hi.
You got a good name.
Thank you. You too. We have actually, I've received numerous of phone calls and emails from concerned parents from our most vulnerable people with disabilities who are working in our community. They have been laid off. They applied to employment. They got turned down. Their worker told them not to apply for CERB, but employment automatically gave them CERB, so they're receiving that $2,000. Now the OSAP, disability are saying are not getting no more extra money. What do you say to those parents who are really stressed right now?
Yeah, well, my heart breaks for them. There's so many people getting laid off, and for them, if I understand the question correctly, their employer told them not to collect CERB. I don't know what right the employer has to say that to them, but I'm sorry.
Disability are telling them not to apply for CERB because they're getting funding through disability.
Okay, well, if they're getting disability, what I understand through the federal government, the program, you can't collect both of them. I'm not mistaken on that. You know something, it's tough right now on every single person out there. Every single person that's being either laid off, and the people that are collecting CERB or on disability. It's tough on these people, and my heart breaks for them. And we just have to stick together and try to get through this this crisis that we're facing as a province. It's very, very difficult for every single person out there. But if you want, Douglas, I'll look into this further, find out what's going on there.
If I can do a follow-up, I know for a fact that I've been told that these people are getting both. They are scared that they will be cut off from disability because they're getting this extra $2,000. And now they're saying it's not fair to them because they have to pay back that $2,000 and they're losing their funding, and they're afraid they'll be cut off from disability because of this. Okay, Douglas, I'm going to look into it, and I'll be able to call you back, or one of our team members will definitely call you back after that.
Next question.
Your next question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi there. My first question is for Minister Elliott, if you don't mind.
Yep.
So the number of elective surgeries becoming urgent and therefore dire enough to require immediate surgery has been increasing over the past 6 weeks or so. So knowing that and seeing that number increase, why wasn't this framework drafted earlier so that the regional steering committees and hospital oversight committees could begin mobilizing, could begin consulting, so that when the time came, they could hit the ground running?
Well, this has been under consideration for some time. We have pulled together a group of people at the command table to deal with this, but frankly, we weren't ready to get to this point to announce it until now. We're starting to see the number of cases go down. We're starting to see the curve flatten, and it wasn't until now that we're able to even consider opening up for more of these scheduled procedures. But if people have been in need, if their circumstances and personal health was such that it was a life-threatening situation, I'm thinking particularly of cardiac or cancer surgery, it would have been done. It would have been done. There have been surgeries that have been ongoing at our hospitals, but we know that we need to ramp them up. We know that there is a big backlog, and we want people to be able to get these surgeries. I know it's very, very anxiety-provoking for people if they have cancer and they're waiting to have this surgery. We want to be able to step it up as soon as we can, but there are many, many issues that come into that decision, depending on the number of COVID patients in a hospital, having the acute care space available, having PPE available, the necessary medications available, having the workforce available, because many hospitals have redeployed some of their staff into long-term care homes that are currently needing extra staff. So there are many variables that have to come into it. So I think it's a question of considering all of those variables which have been put together over a period of time by this group at the command table, and making sure that each hospital now has a framework within which to make decisions which they can then bring forward to the regional table to determine whether they're ready to proceed with these scheduled surgeries. So it's not a simple solution. It required a lot of thought, a lot of consideration to take into account all the variables that we needed to consider for this.
Thank you. And my next question is for Premier Ford.
Yes. Anyway.
Follow-up?
Premier, on Tuesday, after your comments about testing, Dr. David Williams acknowledged that over the weekend, there were a number of regions ready to start testing long-term care homes, but unfortunately, an inadequate number of test supplies were sent, and in other cases, the wrong swabs were sent. So I just wondered, what sort of conversations have you had since then to tighten up that ship and make sure that scenario does not continue to play out?
Well, what I understand, when we're looking at the swabs, we have enough swabs right now. I know one shipment came in, I believe, from the federal government that had to be disinfected, and they weren't up to the quality standards. But everyone should have the swabs. And what I was getting at on Tuesday is we have to we have to work together, all of us, and everyone has to be rowing in the same direction. And some weren't performing the numbers that others were, and we just need to pick up the testing. That's really what it comes down to. But I don't want to point out any one individual. The system has to keep going, and as I mentioned before, the people want us to continue pushing the system to make sure everyone's held accountable. I'm the number one person that's being held accountable, and we have to make sure the whole team continues pushing to get these tests done. The only way we can get a handle on this is to have a very strong testing program, along with the contact tracing as well. You look around the world, that's how countries have been able to get through this hurdle, by a lot of testing, and we're going to continue testing and ramping up the numbers and do the contact tracing as well.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Premier. First of all, just hoping I could get your reaction on a non-COVID story. What is your reaction to Sidewalk Labs pulling out of the Toronto project?
Yeah, that's a good question, Allison. I was informed yesterday. I just want to, first of all, before I start off with this, I want to thank the board over at Toronto Waterfront, or Waterfront Toronto, I should say, and specifically Steve Diamond. He's the chair, probably one of the brightest folks I know when it comes to development and making sure that we get a fair deal for the taxpayers. And it's unfortunate that they've decided to pull out, but I have all the confidence in the world in our development people in Ontario. I look at it now, there's an opportunity for other people to do something spectacular on the Toronto waterfront, and we look forward to sitting down with the mayor and getting his thoughts, and along with the board over at Waterfront Toronto. I think they've done a spectacular job on the waterfront, on this file specifically. But it's unfortunate the company Sidewalk had to pull out, but there's endless opportunities for other people to come in there and do something, again, spectacular for the waterfront of Toronto.
Thank you, Premier. And for Minister Elliott, you've talked a lot about wanting to prioritize cancer and cardiac surgeries when these surgeries resume, but the framework doesn't exactly say that. And in fact, part of the framework says that a hospital could even start with something simple like outpatient procedures. So are you guaranteeing that these cardiac and cancer surgeries are going to be sort of front of the line?
Well, we're trying to take a measured and equitable approach to it, but you're right, there may be some hospitals that decide to proceed with other procedures, whether it's for cataract surgery or whether it's hips, knees, joint replacements, some orthopedic issues. It will depend on what the hospital is able to do. Some of them do have specialties, so that we want to make sure that we can proceed on all fronts in a very measured and equitable way, based on the condition of the patient, of course, and the degree of need. But it's going to be up to each hospital to figure out how they can proceed, what's the best way for them to proceed, what they're going to concentrate on, and that will be coordinated through their regional tables. Some areas may take a regional approach to surgeries, and there may be surgeons who may be redeployed to other hospitals to conduct surgeries. That's all going to depend on the individual hospitals in discussion with their regional groups. But we know that there are many scheduled surgeries that have been postponed, and we want to proceed with all of them in a very measured and careful way.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
I'm wondering about the review for long-term care. Minister Fullerton tweeted out today that there is going to be a review of the system.
Yes.
I'm wondering if you can expand on that, what you're looking at to review, whether it's staffing issues, inspections, how the system handles outbreaks, and most importantly, whether this is going to be public and independent from the government, so the public can be assured that all issues and problems will be looked into.
Well, we're going to review it after we get through this, Laura, and I know the minister is going to come out with more details in the coming days, but our main focus is to make sure it's all hands on deck at long-term care. We know the system's broken. What we're trying to do is get in there and support the people and the infected long-term care homes and help them any way we can. But we're going to have a complete review, not just of long-term care. I think the whole system of government. There's better ways of doing things. We've all seen it, more efficient ways of doing things, and there's definitely going to be a review.
And just on the another topic on sidewalk labs again,
Yeah.
I'm curious, you talk about this potentially being an opportunity for something spectacular on Toronto's waterfront. Surely you're looking ahead to when things get back to normal or semi-normal. What are you envisioning for the possibilities? What to you could be spectacular on the waterfront?
We have some of the greatest minds anywhere in the world right here in Ontario when it comes to the developing an area, and especially the developers, architects, and other people. But it's so important that we communicate and get ideas from the people themselves, make sure we collaborate with the city. This is the city's waterfront, and just work with them. But I have all the confidence in the world in our in the board down there, and the mayor and his team, and our team down there. We're going to do something great. But I think it's a little premature on that right now. We just found out last night the sidewalk was taking a walk. Excuse the pun, but they were taking a walk. But we have some of the best minds anywhere in the world right here in Ontario. But I really look forward to getting some great ideas and again working with the city on this. But there's an opportunity out there, and I think there's an opportunity again to make something just out of this world spectacular down at the waterfront.
Next question.
Your next question comes from Randy Rath with CHCH-TV. Please go ahead.
Hi, Premier. There seems to be confusion over the whole cottage issue. You're saying that people you can't stop people from going to their cottages, but they should keep safe practices while they're there and isolate themselves, that sort of thing. But the locals, at the same time, don't want people coming to their summer residences. In Norfolk, we had the mayor on our show this morning, and she said that their health unit has issued an order, and any summer resident that comes to their cottage will be fined, and that she supports that. What should people do in that instance?
Well, Randy, I was on the phone yesterday. We had that conference call for about an hour and a half. I had all our ministers on there. We had a really wholesome discussion with the mayors, and I fully understand what they're facing day in and day out. And I told them I'd make sure that we got the message out on May the 24th, or the Victoria Day. I think it's on the 18th actually. But when you go up north, if you want to check on your plumbing at your cottage or heat and seeing what's going on up there, this isn't going to be the typical May the 24th weekend. I'm asking you, please, don't bring a whole whack of people up. It's not the party weekend that's been in the past. Go up there, check things out, try to bring your own supplies up there. And cottage country is so massive. It goes all the way to Kenora, all the way out to the outskirts of Ottawa and everywhere else. And I understand the mayor from Norfolk. Actually, she was one of the mayors on the phone asking the questions, and I may disagree, but she has the right to make her own rules in her own town. But this is about working together. We've come so far as a team Ontario, and working together and everyone collaborating and doing the right thing. So my message to the people: you have to go to the cottage and check on things, bring your supplies, and just follow the rules. That's what it comes down to. Follow the same rules as we have everywhere else in the province. Make sure we respect the rules no matter what jurisdiction you're going into. That's the most important. Let's all work together, and we'll get through this. There's going to be many more weekends that we can go up there and have a great time. But right now, just please respect the rules. And I'm going to work with the mayor of Norfolk, a good person. I'm going to work with our MPP, Toby Barrett, as well up there. And it's just every jurisdiction is different and unique. such a massive, massive province.
Follow up?
Okay, thank you. Yesterday, BC Premier Horgan said that he's not prepared to tell people that they shouldn't hug their mothers on Mother's Day and that they should just use common sense. What do you think? Should people be able to hug their mom on Mother's Day?
I have a great deal of Premier Horgan. He's a great premier, but I'm going to agree with him. Let's use common sense. You know, when you go see your mom, and if you have an elderly mother, I don't know, I'd use common sense. You know, again, we think that people over 70 should try to self-isolate to the best of their ability for their own health. So that always worries me. But I think families have enough common sense. They know the health of their parent. I'm gonna leave it up to the families. I just wouldn't think having 20 people over to a house is a good idea at all. I just don't believe that's the right decision right now. But again, families are going to have to use their best judgment on that.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hi, good afternoon, Premier. Many small retailers quite excited to reopen on Monday, but many of them are saying that they're not really set up for curbside pickup, and they're hoping to operate in the same vein as big box stores and grocery stores where people can come in, they can protect themselves, they can keep their distance, but they can actually shop inside the business. So when can in-person shopping in those smaller retail stores actually resume?
Well, we have to wait a little bit for that, Colin, and the reason being is just sheer space. Some stores are small, aisles are tight, but I hear you. These companies are struggling, and some are just hanging on by their fingernails, and we're going to do everything we can to support them as we have. But it's just too early right now to open that wide open, and I just ask them, please hang in there a little bit. We'll get to that point, but we just aren't at that point right now.
All right, thank you. And I had a question for Minister Elliott. Minister, you had talked about COVID-free hospitals for surgeries. I'm wondering if you've identified any hospitals that could be COVID-free hospitals for surgeries, and are you thinking that every region or every LHIN could have its own COVID-free hospital specifically designated for surgeries?
It's a possibility, but we really need to hear from all of the hospitals with respect to their plan, with respect to the number of people they have as inpatients with COVID-19. So it may be an individual hospital, it may be a region, but I think it's too soon to say just yet. We need to hear from them with respect to their feasibility assessment, where they are, what their other measures are, where their staff is. There's many more issues that have to be considered as part of the plan to determine whether one can be a COVID-free hospital for surgeries or not. So I expect that we'll see that in the next short while as the feasibility assessments are completed and then reviewed by the Regional Ontario Health Team.
Last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Oh, hi there. Minister Elliott, since you're still up there, I'll try with you first. Do you know how many urgent cases have developed through the delays? And can you give families or people awaiting surgery any kind of indication on a timeline when some of this could begin? Would it be by the end of the month, for example?
Well, I would say, first of all, that if it's an urgent situation for a cancer surgery, for example, it would already have taken place. We still have procedures that are happening in our hospitals because some people are in situations where their life is at stake. So, of course, those surgeries would continue. But we know that there are tens of thousands of other surgeries that have been postponed, and we want to start moving as quickly as possible. But that is going to really depend on the feasibility of the assessments that come in from the individual hospitals and their review by the regional teams. I know that this is going to be a priority for every hospital because they all want to get back into performing these procedures. I've spoken with several physicians who are surgeons. They want to get back to doing more procedures, but I would say it's going to be several weeks before we're able to get to that, before we can actually start performing those surgeries. But I think it's really important that the process has started, that everyone is anxious to proceed, not the least of which are the patients. And so we want to be able to serve them and to make sure that we can guard the health and safety of all Ontarians.
Okay, thank you, Minister. And a quick follow-up for the Premier, please. Hi, Premier.
Hi, Rob.
Just to follow up a bit on what Colin was asking about stores. Maybe I'm a bit confused about the reopening plan. I thought things were going to be staggered kind of every 2 weeks, and we've seen a bunch of measures in the space of the week. Like last weekend, it was nurseries and garden centers can open for curbside. Now they can open tomorrow, and hardware stores on Saturday, and curbside at other stores with street entrances on Monday.
Yeah.
So how are you going to gauge the impact of these measures if they're all happening so close together?
Well, again, we always go to our health table and get the best advice from the chief medical officer. And as long as people are practicing social distancing and they put in the proper protocols at the stores, especially the big box stores, the hardware stores. But you also have to keep in mind, Rob, that there's, like I said before, there's a tale of two provinces almost. You have the urban center, you have downtown Toronto. That could be extremely busy, and I understand Mayor Tory's doing a good job putting some protocols in place for downtown. And it's no different than the province. We have people in rural towns that they have their local hardware store, and you know they want to go in there and they have 0 cases, and so we have to think of the whole province, and it's a massive province. So you know we're moving forward based on medical advice and science. We're never going to waver from that, and we're doing it relatively slowly. There's still the vast majority of businesses are closed right now, and the sooner we can get the numbers down, the quicker we can get people back to work and getting the economy going again. But there's no rush. Health and is the #1 priority over anything. That trumps anything. And if the chief medical officer and the health team says no, we aren't doing it. But I think it was a reasonable, slow, cautious step forward.
Thank
you. Thank you, Rob. Take care.